I want to talk about a study that we've done in Newcastle University in the north of England, looking at social deprivation and gender differences affecting the incidence of Hodgkin lymphoma in children and young adults. These are people aged under 25 years. We don't have a very good understanding of the causes of Hodgkin lymphoma in children and young people. For better understanding, we need to focus on the subtypes, because Hodgkin lymphoma is not one disease, it comprises a number of subtypes. So there were two aims of this study. The first was to examine the incidence of Hodgkin lymphoma subtypes by age and by sex, and the second was to assess possible associations between variations in incidence and area-level socioeconomic deprivation. So we extracted the cases from our specialist cancer registry, which focuses on these young people and is based in northern England, which has a population of 2.6 million in total of all ages, with around 30,000 births per year. The data extend back to 1968, and we analyzed 621 cases of Hodgkin lymphoma, all the diagnoses in the region, in this age group from 1968 until 2003. We obtained population and socio-demographic data from the national censuses, and we calculated incidence rates and used advanced statistical models to investigate associations with area-based deprivation. That's because individual-based deprivation was not available for all these cases. So what we found? Well, there were 247 of the nodular sclerosing subtype, 105 mixed cellularity, 58 lymphocyte rich, and 68 others. And there was also 143 which weren't otherwise specified, so quite a heterogeneous group where there was not a subtype specified. However, overall, as expected, Hodgkin lymphoma was found to be more common in males. However, there was a reversal of this gender effect for nodular sclerosing cases aged in the years 20 to 24 years, with 72 females and 55 males. So female excess specifically in this age group, but otherwise male excess. Deprivation was calculated using 4 components of a UK-based deprivation score, area-based deprivation score, known as the Townsend deprivation score. And we found that there was decreased incidence of the nodular sclerosing subtype amongst patients living in areas with more overcrowded households. That's an area-based measure of deprivation, where the actual living conditions are more overcrowded. For the not otherwise specified category, the reverse pattern was seen, but since this is a very heterogeneous group, that might well be a chance finding. And there was no effect for the other groups. We conclude that the results for the nodular sclerosing subtype suggest that recurrent infections in exposed children may provide protection against this particular type of Hodgkin lymphoma. The female excess in the ages 20 to 24 years is also really interesting and suggests that estrogens may be responsible, at least in some way, in contributing to this surfeit. But further research is clearly needed, such as case control and epigenetic studies. Just like to thank the North of England Children's Cancer Research Fund for providing financial support, and to my colleague Professor McNally, who's a co-author from Liverpool Hope University. Thank you.